The epidemiology of harm due to medical care remains a pressing issue on a global scale. Serious adverse events can lead to life-threatening situations, which requires inpatient hospitalization or prolongation of an existing hospitalization. Events could lead to persistent or significant damage if it's a birth defect or congenital anomaly. A recent report reviewing earlier studies ranked medical errors cause around 1% of death, putting it as the third leading cause of death. This accounted for more than 400,000 deaths in 2013 alone. Such a high volume of patient harm associated with hospital care is shocking considering the projected annual cost of measurable medical errors in the US alone could be up to $17 billion. The most frequent classes of adverse events, postoperative infections and pressure ulcers, accounted for the largest annual cost, estimated to be 6.5 billion US dollar. Following these, central venous catheter infections and infections following infusions, injections and similar procedures resulted in a combined total of more than 1 billion US dollar in extra healthcare costs. Studies have demonstrated that the most frequent errors result from rather common medical services or drugs for which cost-cutting efforts compromise patient safety and quality of care. The majority of medical errors leading to in-hospital adverse events are not caused by poorly performing physicians, nurses, or other clinicians. They arise from care delivery problems that result from conditions at the levels of the individual patients or staff member, the task, or the healthcare team. At Nubri, we are committed to improving the quality of healthcare and safety of patients by addressing the most common errors and reducing the cost of care. To this end, we have trained a deep learning model to identify adverse drugs events in hospital discharge summaries. The model uses the Hugging Face Transformers library. Masked language model pre-training is performed on a large corpus of unannotated discharge summaries. Fine-tuning is performed on a corpus of annotated discharge summaries using Prodigy. The model performs named entity recognition, but final performance is measured at the document level using the maximum token level scores as demonstrated in this example. Given a discharge summary, the model predicts the drug administered and the adverse events it might have caused. We plan to use this technology to make it easier for healthcare professionals to identify the drugs administered and the adverse events they might have caused quickly and accurately. We are also exploring other models which can identify other clinical entities, including drug, strength, form, route, doses, frequency, and duration. Such kind of entity recognition allows healthcare professionals to easily identify the drugs administered and make informed decisions on further treatment, as shown in this example. Me, a postdoc at Max Planck Institute for Molecular Genetics, together with my co-founder Rajeshwar Dital, a former machine learning engineer at Nubri, are committed to improving the quality of healthcare and safety of patients. Thank you for your attention.